Hey guys, so my patient case is actually a re-evaluation that I did with someone else, another student, Janon, at the CRC. So our patient is a 44-year-old female working in food prep, and she's a cook. She was diagnosed or referred diagnosis with right foot pain and ankle pain. She recently had surgery in April, I believe, for bone spur removal in the right foot. So her chief complaint is pain and swelling in the right ankle and foot, especially while walking or standing on it, and she has a lot of trouble with stairs. For the subjective examination, so we kind of, because it was a re-eval, we had some of her information already. But we just asked her again about how her exercises are going, how she's progressing. So really still having that right ankle and foot pain, especially in the right heel. She does cook a lot, so she continues to have a lot of trouble with prolonged standing, prolonged walking, a lot of difficulty with stairs as well. She has had a history of right foot pain for about 7 years, but recently got to surgery, and now she's come to physical therapy because of that. So some of her aggravating factors are, again, prolonged standing for like less than 1 hour, walking for less than 10 minutes is about all she can do. Her easing factors are sitting, resting, icing it, things like that. We retook range of motion and manual muscle testing. She continues to show just some weakness just in like the musculature around the right lower leg, so like your tibialis anterior, tibialis posterior, gastroc, and we also did some range of motion for dorsiflexion, plantar flexion, inversion, and eversion. And she is still showing some limited range of motion in those as well. Our current interventions that we're doing with her, so we're doing a lot of stretching of the muscles as well as mobilizing the joint. We're doing some single leg heel raises, some gait training. So we had her on the treadmill doing some treadmill training and having her walk again, getting her used to walking. She shows a lot of weakness still with like heel raises, so we're doing heel raises to work on some of that strength there as well. Her response to the interventions are pretty good. She still has a lot of pain, but she's progressing well, and everything seems to be going as planned based off of her initial eval. Yeah, so she does show some abnormal gait, so she is guarding the right side when she walks a lot, so you'll see a shorter step with that. As for the progression over like the next 3 weeks, we hope to continue with getting some of the motion back, as well as improving the strength. Her anticipated discharge, I think we said about like maybe 6 more weeks or so, but we'll come to see her for 1 time a week, and yeah, thank you.